Oh, feels so good. This is your patient assessment / management medical station. You have 2 minutes to review your equipment and ask me any questions.
Okay. All right.
You're dispatched to a 20-year-old unconscious female. I will be your witness. You may begin.
Okay. My PPE is in place. Is my scene safe?
Yes.
My nature of illness is an unconscious patient. Is this my only patient?
Yes.
I'm going to request additional ALS transporting unit, and I consider C-spine, and can I have my partner hold it?
Yes.
Okay. My general impression is my patient is laying down and is unresponsive. I'm going to now check her level of consciousness. Ma'am, can you hear me? Ma'am? My patient's only alert to pain, and I'm not sure her chief complaint is. Do you know what she was complaining of before she fainted?
She said she's not feeling well and then fainted. I do not know what was wrong.
Okay. I'm going to assess her airway. I'm going to open her airway. Her airway's patent. I'm going to assess her breathing.
Lung sounds are clear and equal bilaterally.
Okay, lung sounds are clear and equal. She's ventilating adequately because her chest is still rising bilaterally. I'm going to put her on 10 liters of oxygen via non-rebreather, and I'm going to check her pulse.
Pulses are equal bilaterally.
Okay. I'm going to check her skin real quick.
It's pink, warm, and dry.
Her skin is pink, warm, and dry. And I'm now going to check, is there any major bleeding anywhere?
There is not.
No major bleeding? Okay. This is a priority patient, so I'm going to transfer her immediately, and now I'll move on to my history taking. Do you know if this started, I would ask like if her pain started gradually or suddenly, but since this isn't pain, I can't really ask that. But do you know, did she start feeling like sick or anything?
She just mentioned that she's not feeling well.
Not
like
feeling
a couple
well?
seconds before she
Okay.
fainted.
Did anything make her feel better or worse when she was sick? Do you know?
I don't know that
Okay.
those answers.
I would ask if this was a pain assessment, or if she had a pain problem. I would ask if the quality, like if what it felt like, and if her pain moved anywhere, and what it was on a scale of 1 to 10. Do you know exactly what time this started, when she started feeling a little weird?
It was a couple minutes ago.
A couple minutes ago. Okay. Do you know if she's allergic to any medication?
No, she's not.
Did she take any medication?
She takes an aspirin a day.
And what did she take it for?
Angina.
And does she have any past medical history?
Just the angina.
Okay. And when was the last time she ate or drank? Do you know?
She had lunch around noon.
Around noon. Okay. Do you know what she was doing when this happened?
She was cooking.
Okay. And for my secondary assessment, since I don't really know, I'm just going to palpate really quick on her chest, her abdomen. I'm going to palpate her arms, just checking, making sure I don't feel any, I'm looking for decaf BLS, which is deformities, contusions, abrasions, punctures, burns, tenders, lacerations, or any swelling. Do I know anything?
No.
No? Okay. I'm now going to check her vital signs. So I'm going to get her blood pressure.
The patient's skin is becoming diaphragmatic and clammy.
Okay, my blood pressure is 110 over 80. I'm going to treat my patient for shock. I'll cover her with a blanket. I already put her on the oxygen, and she's already positioned properly, laying supine. And I'll take her respiratory rate, so I'll watch her chest rise. Her breathing is non-labored, and her respiratory rate is 16. I'm going to check her pulse. What's her pulse rate?
It's 120.
120. Okay. Pulse is 120. And I'm going to my interventions for this patient. I'm going to check her blood sugar real quick. What's her blood sugar at?
It's 21.
Okay, so my patient is having a diabetic emergency. So I would administer 15 grams of oral glucose, but since she's unresponsive, I'm not going to, so I'll be waiting for my medic unit to arrive. But in the meantime, I'll be reassessing my patient every 5 to 10 minutes, checking vital signs and responsiveness. My interventions were just the oxygen so far.
Your medic unit has revived.
Okay.
What would be your report?
My report to the arriving EMS unit is I have a 20-year-old female who has a history of angina and takes an aspirin a day. She was cooking when she suddenly fainted and fell over. She is alert to pain, and I put her on 10 liters of oxygen via non-rebreather. Her blood sugar was at 21, and I have only done intervention of the oxygen.
Is there anything you would have changed or done differently?
Her vital, no.